Dr. Tracy Collins picked quite a time to answer the call to serve New Mexico. The population health expert will leave UNM Hospital and become the state's next Secretary of Health. This week, NMIF correspondent Megan Kemrick grabbed a few minutes of Dr. Collins' time to talk about the pandemic response, its impact on vulnerable communities, and how she'll approach the job she starts next month.
Thank you for joining us, Dr. Collins, on New Mexico in Focus.
Thanks for having me.
COVID-19 is at the front of almost everyone's mind right now. How have you worked on the pandemic during your time at the University of New Mexico?
So I've worked on the pandemic at University of New Mexico by helping with creating protocols for reopening safely and keeping students, faculty, and employees safe once we are reopened. So I was involved with figuring out about messaging and assisting with that. Also helping with understanding testing and how we stand up appropriate testing sites, and then also with contact tracing. So those have been my efforts to help with the pandemic, in addition to my role as Dean of a college of population health, in which the epidemiologists within the college were helping with understanding the evidence and keeping the state informed.
What aspects of the pandemic response are drawn from why you decided to create a career in population health?
You know, I see population health definitely as the partnership between multiple disciplines, but largely public health and healthcare delivery. And so for me, this pandemic really highlights the value of public health practitioners and physicians, nurses, other healthcare professionals working together to really do a good job of containing or controlling this virus, this pandemic.
The last health secretary was very open about the magnitude of the pandemic challenge and the danger of burnout. Why take this job?
Yeah, a great question. I feel like, and I think Secretary Kunkel did an amazing job. She really stepped in and was awesome. I feel like for me, I'm coming in at a point where we have to start thinking about distributing the vaccine once we have an efficacious vaccine, and making sure that we do that well. So I see this as an opportunity to make a difference. You know, I came to New Mexico to help grow a very new college, the second of its kind in the country of population health. And that was an opportunity. And I see stepping in during this pandemic to help with the Department of Health to lead as another opportunity to give back to this great state.
How will you guard against burnout, both for yourself and for your staff?
Yes, so my approach to avoiding burnout is really to make sure that I spend quality time each day exercising, spending time alone, reading, reflecting, and then making time for my family. I want to also ensure that there's wellness for the folks at DOH. So ensuring that we balance commitments and responsibilities with personal time so that people don't feel like they're working 24/7, even though a lot of how we respond to this pandemic will require a lot of hours, just ensuring that we make sure people have time off.
How do you plan to bring that passion that you have for population health to your work as the DOH secretary?
I think the passion will come just from making sure that we're doing a good job. And so my passion for population health, I love research. I love taking care of patients. I love understanding the needs of diverse communities throughout the state and throughout the country. That passion will carry over into my role as the secretary for the Department of Health.
The pandemic has had, as you know, a disproportionate impact on communities of color and low-income communities. People either cannot work remotely or they lost jobs in the economic turmoil. How do you plan to guide the COVID response in the state with those realities in mind?
Yeah, I'm going to use and work with the folks who are there to understand what the needs are for the communities of color and other communities as well. We really have to make sure when we think about essential versus non-essential that we're not biased against those who are most fragile. So the frontline workers are not just the folks delivering healthcare, which are very important, and they need the N95s. We also need to think about the PPE for the grocery store workers, those who are driving public transportation. And so we need to make sure that we have adequate supplies for multiple communities so that they can keep themselves safe and still continue with their employment, as well as providing eye shields, things to cover the eyes. We know if we focus on the nose and mouth, which are key, but you can also contact this virus through your eyes. So it's important for people to cover their eyes as well, maybe with a plastic face shield or goggles to try and keep the virus out.
New Mexico was really doing well for a long time in controlling the virus. And now we're seeing record case numbers that threaten to overwhelm our healthcare system. Do you have a sense of why this is happening and how much DOH and other agencies can do to help bring it under control?
Yeah, I think what you're seeing currently with the 2-week lockdown, shelter in place, is an effort to try and contain the virus. I definitely think we need to continue with the messaging around wearing a mask, washing your hands, and distancing. And we need to encourage people to not engage in private gatherings that involve more than 5 people, that it really needs to be a small number, and you really should stick with the folks who live with you. So as we approach Thanksgiving, as we look at the holiday season, this is the time when people really like to enjoy their family. But unfortunately for 2020, this is not the year to do that. I really want to encourage the public to hang on and wait one more year, because we really need to get a solid vaccine and to get it distributed.
A friend of mine who's a doctor here wrote a letter this week to the Albuquerque Journal, and he argues that we need to change strategy on messaging and really show the brutal reality of COVID, much as we did with smoking years ago. What do you think?
Yeah, it's, if you turn on the news, you can see the case count and the deaths going up every day. We're at nearly 250,000 of reported deaths. I think the more we can get the attention of the public, the better. And sometimes things that are more graphic will get the attention a lot better. I'm not a huge fan of that, but I do see the value if we need to get the attention of the public. For those who are naysayers that this is not a real virus, it's not that bad, we do have to take additional measures. So I think it's realistic to go in that direction.
Can I ask you a follow-up? Why are you not a fan of that? Do you think that's not an effective strategy?
It's not that it's not effective. It's just that if we could get your attention without being brutal or graphic, I would prefer that. But if it's needed, we can move in that direction.
My friend also argued that we need stronger enforcement on people violating public health orders. That includes even breaking up gatherings, being more aggressive about fines. Do we need to stop hoping people will do the right thing?
Yeah, it's a great question. I think that where we can enforce is more in public settings. It is very hard to ask law enforcement to go to someone's home and break up a large gathering. Even those efforts have failed recently, with people reporting that there's activity going on that they know isn't safe with a neighbor or so. And there's not been much response from law enforcement because it's quite challenging. And so I think as much as we can enforce it with fines, that I actually am in agreement with that. I just think it's going to be challenging if we ask law enforcement to start driving around to homes to break up large gatherings. We really need to trust people to understand that this is not the time for large gatherings.
A survey that's gotten a lot of press in the last week found that about 40% of Americans plan to travel or plan to have Thanksgiving gatherings of 10 people or more. Is there anything that we can say to folks to try and curtail this?
Yes. If you don't want to experience putting your loved ones at risk and others at risk, you would not have gatherings, large gatherings of that size you just mentioned. If you're thinking, oh, this is Thanksgiving, I got to see mom and or grandmother. Yeah, you might see them at Thanksgiving, then you come back home and you may not see them at Christmas or even be able to Zoom with them because they've been exposed to COVID. This is not the time to ignore what we're telling you to do, and that's to avoid the large gatherings. Please don't.
Of course, we know there are people who simply cannot work remotely if they're frontline workers or they can't socially distance, if they live with a lot of people. How can public officials offer more support for folks like those?
Yeah, so really trying to identify alternative options for keeping people safe in multi-generational homes, whether that be additional sites where you can place people if they need to quarantine or isolate. So it really is identifying alternative options for where people can safely be housed if they need to isolate.
Are there problems that you've been able to identify that you think other departments might better be able to solve, aside from DOH?
You know, I am so new with the position at this point. I'm still gathering more information. I'm sure as I transition to my start date, I will learn more and have a better understanding of where we can offload some of DOH responsibilities to other agencies. But right now, I'm not aware of anything that we really should get rid of.
How do you see the Department of Health coming alongside other departments like Human Services as you start your work on fighting the pandemic?
Yeah, I see it as a partnership that we can help each other do a good job for the state by building on our expertise and identifying where one department can focus on a particular area and the other can address another area. I think it's the partnership piece that I look forward to with working with other departments, including Human Services.
Do you have any thoughts about how to better handle the spread of COVID in prisons and jails?
Yes, that is a very good question, like many of your questions so far. I think it's understanding what space is available in the correctional facilities that might provide for spreading people out and keeping people safe. And then certainly looking at options for safely releasing persons who are nonviolent. And if they're close to being released, can we expedite that date?
What are other issues that you hope to work on as DOH secretary?
Well, looking at recreational cannabis and understanding what the needs are in the state. There are several other issues that I'll be learning about, and I'm actually going to start gathering more information over the next several weeks until my official start date, which is December 14th. So I'll know more as we move forward.
And finally, I was wondering if you'd share how you decided to go into healthcare with your upbringing.
Yeah, so it was really kind of multifactorial. In high school, I liked chemistry and talked with a chemistry teacher about how I could use that interest. And he informed me that, you could become a chemist, you might think about medical school. And so I thought, that might be an option for me. And then I had an issue with my mother even before high school where I felt like she really didn't get good care. She was accused of drug seeking when in fact she had a small bowel obstruction. And it took a lot of visits to the ED, even an attempt to fly to another state to be with her sister, who was a head nurse in Louisiana. She didn't make it because of the layover. People noticed she looked a little strange and not well. She was dusky, not breathing very effectively. So she was rushed to the hospital, had emergency surgery. And after 3 months of being in Denton, Texas, and then we were in Oklahoma, we'd travel every weekend to see her. She made her way back to Oklahoma to continue to recover. But it was that experience with my mother, my interest in chemistry, that got me into medicine. And then as a resident in internal medicine, I realized I love taking care of patients, but I wanted to have more of an impact on how we deliver care, which led me to getting some additional degrees in public health and healthcare delivery. And those additional degrees really got me engaged in understanding the social determinants of health, or those upstream factors that determine health and health outcomes. And that really led me down the path towards population health.
Well, Dr. Collins, we appreciate you talking with us as you make this next jump in your career to head the Department of Health. Thank you.
Yes, thank you. I appreciate the time.